Parkland is a hospital set up to primarily take care of the indigent patients of Dallas, but it serves a much broader scope than that does now, in terms of centers of excellence in burns, trauma, now epilepsy, diabetes, etc. And a lot of very bright people who are here both to be educated and here because they really want to take care of patients well and learn how to take care of patients. That's all. I mean, that's gotten bigger, but that's the same.
In 1963, I was in the second year on the faculty at Southwestern, and I was generally just teaching residents in the operating room, making rounds with residents, helping train residents do surgery. And we had medical students who were attached to our individual surgical services. And so we took part in the teaching of medical students, sort of on-the-job training, if you will. And that was my principal activity. I often tell people that, well, I'm a professor of surgery, and they sort of think, oh, I'm standing in a classroom at a blackboard teaching people how to. That's not the way it is. It's a matter of standing at an operating table and showing people how to do surgical procedures. So that was my day-to-day activity. And much of that was operating on trauma patients as well as elective surgery patients, along with the residents and the interns at Parkland who were associated with the students at Southwestern who were also attached to our services.
When all of a sudden I heard this, I smelled rubber burning. I mean, a horrible smell. And at the same time that I had that, I think it's where the doors were opening, then all of these policemen came screaming in saying, we need an ambulance carriage, we need something, come help us, we have an emergency.
Dr. Perry and I went down to the cafeteria to eat. In the cafeteria, the employees and the doctors could eat in the cafeteria. We had just sat down and the operator began to page Dr. Shire's stat. He was chairman of the Department of Surgery, and I knew he was out of town, and I knew he didn't have any patients in the hospital, so I thought that was a little unusual. Then she again began to rapidly page other surgeons, Dr. Kemp Clark, neurosurgery, and so on down the line. That was highly unusual, and so I looked at Dr. Perry, and he didn't know what was happening either, so there was a phone on the wall. We only had 1 or 2 phones in the cafeteria, wall phones, and I walked across the cafeteria to the wall and picked up the phone, called the operator, and I told her I was Dr. Jones, and why was she paging everyone's stat? And she said the president's been shot, and they're bringing him to the emergency room, and they need doctors right away.
On November the 22nd, I was in the operating room at Parkland, and I was showing a film of how to repair a hiatus hernia in one of the conference rooms there in the operating room to some of the surgery residents. And I heard a little tap on the door of the conference room, and I went to the door and looked out, and Dr. Crenshaw, Chuck Crenshaw, who later wrote a book about his experiences with some comment being made about that later, but he was standing there and he asked me to step outside, that he needed to tell me something, and so I did. And when I did, he said that they had just told him that they had called the emergency room and that President Kennedy had been shot during his motorcade downtown, and they were bringing him at that moment to the emergency room, and that they had called and said that they should page all of the surgery faculty to come to the emergency room immediately. And so he was telling me that. And so he and I got on the elevator next to the nurses station there in the operating room and went down 2 floors directly to the emergency room. And while we were riding down in the elevator, I tried to reassure myself and Dr. Crenshaw by saying, well, Chuck, you know, we often get these tales about what they're bringing into the emergency room. It turns out not to be nearly as bad as they said. And so with that, the door opens of the elevator, and we walk around a little angle and walk out into an area we call the pit, which was a big area, about 50 square feet, 50 feet on each side. And around that were all of the patient cubicles where emergency patients were seen. And extending off of that big pit area were the 4 trauma rooms where we took patients in for resuscitation and actually even some minor surgery sometime who had been brought in with injuries and whatnot to the emergency room. There was trauma room 1 and 2 on the right side, and trauma room 1 and 2 on the left and the right side, and trauma room 3 and 4 just adjacent to that off of this hallway, which was immediately adjacent to the pit. So that's what we walked out into. And that pit area was jammed with men in business suits, all of them wearing, as everybody did, hats back in that. So I thought, I'd never seen a crowd like that in this area. And as I thought that, the crowd spontaneously parted, and I could see through that crowd of people, the corridor through the crowd of people, sitting near the entrance to trauma room 1 on a folding chair was Mrs. Kennedy in her bloody clothing. And I thought to myself, my God, it really did happen. It's not just a story that's been exaggerated. And so I thought immediately also at that time that I knew Dr. Shires, my chief of surgery, was in Galveston at a meeting of the Western Surgical Society. So he was not here. And I thought, well, where are Dr. Perry and Dr. Baxter? It was about noon, and I immediately thought more than likely they were somewhere along Harry Hines at one of the hamburger joints, as we often went out to get a hamburger, and that's what they were doing. And I was the only surgical faculty here. I had had my 34th birthday 2 days before that, so I was a very young, very wet behind the ears surgeon, you might say. And I literally had to almost force myself to walk back toward trauma room 1 where Mrs. Kennedy was. And as I walked back and entered that area where the trauma rooms were, Doris Nelson, who was the nurse in charge of the emergency room, was standing there between 2 Secret Service men, or at least I assume that's who they were. And she was telling them who not to let by or who to let by. And she motioned that I should be allowed to go by. And I went by Mrs. Kennedy and pushed the door open to trauma room 1. And the first thing that I was horrified by was President Kennedy's bloody head and face, which was being lit up by a surgical lamp that was shining on him. And I was also, at the same time I was horrified, I was gratified to see that Dr. Baxter and Dr. Perry had just preceded me into the room, and so that I was not alone. And Dr. Jenkins, in fact, our anesthesiology professor, had just arrived with an anesthesia machine because he had gotten the word about what was going on in the emergency room. And so that's what I walked into.
We all went through what we had been well trained to do. It was not any hesitancy, not any, okay, this is the president. You know, everyone in that room were very well trained trauma doctors. And by the time we started working on him and got him undressed and got him intubated, why the room was full of doctors and nurses and attendings.
Your job in a patient who's severely injured, it kind of goes in the steps of do what it takes to keep the patient alive. Then you go back and evaluate the injuries more detail and kind of make your long-term plan. And the keeping alive, first you got to have way to breathe. Second, you got to be breathing. Third, your heart's got to be pumping. And fourth, your head's got to be working. Your nervous system's got to be working. So your job is exactly that. You see what's going on with the airway, you see what's going on with breathing, you see what's going on with the circulation, and then you look at at neurological function. Usually one person kind of takes charge and everybody else, one team gets some IVs going to support circulation. The nurse kind of gets the patient undressed and keeps things flowing. And that's pretty much what we did.
As I looked at the president, he was motionless. His eyes were open. I never saw any movement during the time we were evaluating him or treating him. And Dr. Carrico was trying to put a breathing tube in his throat, and was having some difficulty, I thought. And so I just told Dr. Press, I said, why don't you do a tracheotomy and I'll do a cut down. Dr. Richard Dulaney, one of the urology residents, and Don Curtis, an oral surgery resident, were both down there, and they were attempting to start an IV with a needle. But obviously the president was in profound shock. The veins were collapsed. They were unsuccessful in getting that started. And so as Dr. Perry started the trach, I could not get around to a cabinet where the IV tubing and cut down, that is a tray where you could cut and isolate a vessel, a vein to get an IV started, and a tracheotomy tray.
Well, what I know in retrospect, at least what I believe, is that President Kennedy had some severe arthritis, etc., and had been put on steroids for pain relief or for relief of inflammation. And when you put people on big doses of steroids long enough, the adrenal glands quit responding. And apparently his adrenal glands had quit responding. Whether he had any primary problem with his adrenals, I guess we'll never know, because they were not part of the autopsy. But the way we kind of had some hint that something was going on, as I say, we were aware of all the noise in the press, or some of the noise in the press. Somewhere in Congress, within a few months before the president's assassination, there had been a discussion where somebody had said that the president had Addison's disease, and Bobby Kennedy had said, Addison's disease is caused by tuberculosis. My brother's never had tuberculosis, therefore my brother doesn't have Addison's disease. Well, the logic is there, but the logic to a country boy is that that's a little evasive, right?
He had a back brace on. You know, he had Addison's disease, and he had a lot of low back issues, and he had a very, very rigid corset that he wore that had to be removed. And one of the most important medical things that Dr. Jim Carrico did was within minutes of his entry into the trauma room 1, Carrico said, we need to give him some hydrocortisone because he has Addison's disease, and this trauma will be an extra stress. He didn't elaborate, but everybody knew that he was right, that that's what we needed to do. And Dr. Selden later, I heard comment that was so smart, that he didn't expect this surgeon to think along lines of Addison disease and steroids so brilliantly as Dr. Carrico did.
When we took care of President Kennedy, I didn't have time to change in the scrubs, and I was there taking care of him and standing at the head of the gurney in my suit. And so my suit was soaked in blood. And the next day, my wife took that bloody suit to Fishburne's cleaners and had it cleaned. And the cleaner, in fact, asked her, are you going to have this suit cleaned? And she said, yes, my husband only has 2 suits. And so She got it cleaned, but I kept the shirt that had blood stains on it.
People frequently ask me about when we realized what had happened. And it really was not until after Governor Conley had gone to the recovery room and Dr. Jenkins called a kind of a meeting, an informal meeting in his office. And we all went in there and sat down and had a cup of coffee. And at that point, we said, holy mackerel, something really important has happened here today. This is part of history.
And it was soon after that, when we did leave the room, we went back up to the operating room and sat down near the nurses' station where there was a coffee pot. Dr. Perry, Dr. Baxter, Dr. Bashur, and Dr. Peters, and several other people. And we sort of looked at one another like, did this really happen? You know, that was the first time that it registered on us rather than us just reacting to it. And that before we had time to think about it, that was the first time that we thought about it. And it was just like you had been in a nightmare. And that one of those things you can really hardly believe that you were directly involved in.
My choice of anesthetic drugs and my management of the anesthesia virtually, totally, completely obsolete now. Probably only 2 drugs left that I gave him still in modern practice.
Really?
Yes. And so that emphasizes the importance of continuing medical education for doctors. Doctors have to keep up because things change very rapidly.